Hello and welcome to the KOFISI Connect podcast, your source for a wealth of roundtable discussions on the workplace and business, as well as cultural news and trends from the diverse and dynamic continent of Africa. I'm your host, Richard Okenye, and today I'm very pleased to introduce Dr. Moez Dungarwalla. Dr. Moez specializes in family medicine and obesity medicine / weight management. He's also currently finishing up his FIFA diploma in sports and exercise medicine and will join the FIFA Medical Network soon. As you are very keen in progressing with our wellness offering across KOFISI, we are here now to discuss men's mental wellness with Dr. Moez, a man himself and a man myself. I think this is going to be a therapy session for me. So I'm sure I'll get a few pointers. Welcome to the podcast.
Thank you. Thanks, Richard.
How's your day going?
Yeah, not bad. Not bad at all.
How are you mentally?
That's a loaded question, isn't it?
It is.
I think as well as anyone can be, living in the 21st century. Yeah.
What's your general, let's just, before we introduce yourself and, get into your professional experience and background, what's your general view on the state of mental health for men, especially in Kenya? Just a general
view.
Yeah.
Well, men don't like to seek help, I think, is a key thing to come across. And often I see men, usually when things have reached not crisis point, but getting close to it. And so I think it's really important we shed light on recognizing when cracks are starting to appear.
Right.
Before the damage is done, so to speak.
Right.
And it's not just in Kenya; it's all over the world. Men struggle generally, and they're not immune to mental health issues. So, yeah.
Okay, that is correct. There's a couple of scary statistics which I'll throw in there along this conversation. But before we get into that, I'm hoping, of course, again, at the end of this podcast, we're able to shed light into how to see those cracks before they even start to show, or how to feel before the cracks start to show. Yeah. You have specialized in family medicine and obesity medicine, weight management, maybe a little bit of, clarity into what that means, and your time in the UK.
Yeah, so I'm born and raised in Mombasa in Kenya, and then ended up in the UK for my med school in London, and then did my foundation years and whatnot. I was going down the road of cardiology up until COVID hit, and then I think I had a fork in the road moment where I had to decide whether I want to dedicate my life to cardiology and waking up at odd hours in the night and being rushed, to work and whatnot. So I then pivoted my career into family medicine because it gave me more job satisfaction, being able to go through the whole patient journey with somebody and not just see them as an organ. So if you're a cardiologist, you're seeing the human being as a person with a heart. If you're a gastroenterologist, you're seeing them as a person with a GI tract, whereas family medicine, you see the person as themselves and all the sort of things that go with it. So that's why I picked family medicine. And then within that, because family medicine, one of the core fundamentals is preventing illness and risk factor modification and such. Obesity became a natural progression into that work. So I started becoming what we call in the UK having a special interest in metabolic medicine and obesity medicine. And with the rise of GLP-1s and a better understanding of metabolic health, I decided to kind of build my career on the back of that. So,
all right. Yeah. Is there a mental angle to it?
Absolutely.
Yeah.
Yeah, for sure. I mean, mental health, and to be honest with you, and any physical health issue, they go in hand. But the case is definitely true with people struggling with their weight and mental health. Yeah.
Yeah. As you started right at the beginning, which is men do not like to, discuss or talk about their mental health, or even just check on a general scale. In your clinical practice, you've seen men who are very high achievers, and we see that a lot at KOFISI. We see it with our CEO, always up and down, always on flights. When they come into you for a checkup, weight gain, fatigue, hypertension, how often is it a mental and not a physical issue? And how do you start that conversation?
So in my practice, I can comfortably say that between 30 to 50% of my consultations have a mental health angle. And that's not because I'm trying to bring it up. It's just that it's such a burden on the general population that it eventually comes up. And what you find the differences between men and women in terms of how they present to their doctors. Women will come out right and say, okay, I'm struggling with X, or I've got increased anxiety about such and such, and my mood is not great, so on and so forth, and they come out with it. Whereas with men, it's sometimes a little bit more layered, and you'll find that they'll come in with a physical health complaint, palpitations, fatigue. You mentioned about weight. They might find that their blood pressure is on the higher side, which you've also touched on. And often that's the smoking gun. And you try and address those things, but then you find that whatever you're doing, it doesn't seem to be working for the patient and for the man. And they'll keep coming back to you. Oh, my palpitations are still there. I still can't sleep. I still feel breathless. I can't go to the gym as much, blah, blah, blah. And that's when you have to kind of, bring it head on with the person and just ask them, how are you coping? How, is there anything that's changed in your life recently? And at that point, I think the whole facade unravels. And then when men feel like they're in a safe talking space and that they can, voice their concerns, we can then start, picking things apart and trying to rebuild it together. So often there is a lot of layers before you end up getting to the whole root of addressing, a man's mental health. Yeah.
I often find myself just throwing stress as the word for everything. And I'm sure that's the case with most men. I'm just stressed, just stressing about work. How do I label that line and say, this is not stress, I am struggling mentally? How do I tell?
That's a very good question. Yeah. I think first and foremost, we have to address this whole concept of stress. Stress is how we perceive a threat, and the threat in air quotes. Nowadays, in the modern life, we don't necessarily have threats to our physical self. We're not evading predators and that kind of thing. And so that kind of stress has morphed into a more emotional and mental health stress. You can't run away from stress. Stress, up to a certain point, is somewhat healthy, so to speak. It keeps you sharp, it keeps you on your toes. But it's being able to de-escalate from the stress, go into a kind of a more neutral mental health, environment, so that you can then be fresh, so to speak. What I think you're confusing is between stress and burnout, where we've got all these expectations with work, family, different societal roles as men, and especially in Kenya, sometimes these roles can be quite rigid. We find it hard to delineate between the two. But I think up until a point where your mental health burden is now stopping you from what you're able, what you need to be able to do. So your roles at work, your roles as a father, husband, brother, son, then it means that we have to start taking a look into how this stress is affecting you and how we remediate that. Mm-hmm.
Is there an effect on, like a physical effect?
Yeah.
My heart, neurological issues.
Yeah, I mean, like I said, acute stress or stress in the short term, that's fine. Your body will cope with that. You'll move on. But if the stress is just sort of prolonged and it's just chipping away at you and it's unresolved, for sure, it's going to take out onto your physical body. Mm. And one kind of analogy I illustrate with my patients is we all know that we have two entities. We have the brain and we have the mind. it obviously exists in our head. But where one stops and the other begins, so where the mind stops and the brain begins, that boundary is not very clear. But when our mind is overburdened, it will spill over into the brain. And what that means is that you'll get an emotional burden spilling over into the physical world. So your body will take it out on itself. So you will have faster heart rate, you'll get more palpitations, you'll struggle with heartburn, your risk of metabolic issues like diabetes, cholesterol, blood pressure issues, that goes up. And then neurologically as well, there is some tenuous links between chronic stress and the development of things like dementia. So it's definitely something that does have long-term physical health ramifications. So it kind of emphasizes the fact that we do need to listen to our bodies more, because often we have warning signs before we even recognize that they're warning signs.
Right. Should I ignore the pressure?
Say again?
Should I ignore the pressure I have? So just as a means of de-escalating the stress, because especially for men in Kenya, the expectations that the society has on you will never stop. I'd say for my case, I have something we call black tax.
Yeah.
I'm sure you've heard of that a lot. You're a firstborn, you have, all these responsibilities, you end up being a father, you have kids. This is non-stop demand on you. How do you not stress? How do you not stress? When someone brings up my stress, like, don't stress, man. These things, they always sort themselves out. Like, I can't not stress.
Yeah.
So I guess my question is, how can I not stress?
Yeah. I mean, I think the fact that you labeled it, should I ignore it? This is something that the vast majority of my patients who do struggle with their mental health kind of think that that's the coping mechanism. I mean, if you're going to ignore emails from KRA, it's only going to...
The obligation isn't going away.
Exactly. It's not going to go away. So the same thing is you can't ignore stress. You can't just kind of say, oh, don't think about it. That's not really a sustainable coping mechanism. I think the thing is we have to understand that with our very complex way of life at the moment, and we have multifactorial aspects to our stress. It's not usually one specific thing that's causing us to stress out. We have lots of little different things. And if we don't realize how we are applying ourselves to all those different facets of our life, if we cannot say that, look, if I'm spending 16 hours at work and neglecting my family life, or I'm using work as a sort of outlet to try and, ignore my other commitments or ignore other stresses, it's just going to bite you back. And so often you have to have a real talk with yourself and a moment of reflection to say, okay, this is how I'm currently doing, handling the situation. You have to then also be real with yourself, okay? And understand that, okay, if I'm not exercising, if I'm not eating well, if I'm not sleeping well, if I'm drinking a bit too much, you can't expect all your stresses to then go away and you paper over the cracks. So it's kind of doing the what we call the low-hanging fruit first, looking after yourself in your physical health first, and then eventually the mental health side of things will fall into place.
Right. We've heard of wellness hacks and supplements. Take this, take that, and you'll be fine. If you can't work and you're stressed, you can take something to just stay up and do it, and then maybe you'll forget. There's a lot of, and then in this age of content, there's a lot of doctors on TikTok. There's a lot of doctors on Twitter, and everywhere with a hack. There's a gym enthusiast or a fitness coach here around the corner, 2 scrolls away. What's from a medical standpoint, what's actually the best thing to do? Where do we go?
You're not a software. You can't hack your mental health, right? You can't go to change the code and suddenly, you'll get better. And I think the whole concept of a hack for mental health is almost an ironic statement because, like I said before, the stress is so multifactorial that a certain stack or a combination of supplements and fringe therapy might work for one, it may not work for others. I think something to kind of illustrate this concept where you can't start chasing external things to fix something internal. You're not, when you are thinking of building your house, you're not going to start the whole process by designing your bedroom. You're going to first start building the walls, right?
Yeah.
Get something, foundational. And the way in which you can do that for yourself is you start by the low-hanging fruit, like I said, cutting out the alcohol or cutting it down as much as you can, addressing your sleep, and exercise. And you'll spend a fortune doing cold plunges, sauna, going for this NAD drip or this supplement, and you'll end up going round and round in circles. But if you don't establish the basis first, all these fringe therapies, it's unlikely to make any improvement to your overall well-being.
Right.
So my key thing is that if you want to start hacking your wellness, start by first putting that into your body. So working out sleep hygiene, making sure you have a consistent amount of sleep, going to sleep at this consistent time, waking up at a consistent time, addressing your diet, so avoiding highly processed foods, cutting down alcohol where possible, and then going to the gym or exercise in any capacity. If you tire your body out, your mind eventually will also get tired. And that will allow you for that restfulness, which is how you're able to bounce back and then meet your commitments head on.
Right. Regenerate.
Yeah.
Yeah. Love that. There is no mental health stack, because that was going to be my next question, which means that's already answered. that doesn't exist. To stay productive without burning out, that means just sleep early and plan yourself.
Well, yeah, I mean, if anyone has the answer of staying productive without burning out, I think they'll be a trillionaire, because that sounds like cocaine to me, energy and mental clarity. Eventually, we get tired. We're human beings. We're not androids, okay? Yeah. I think the thing is that you have to balance your commitments. You have your work, but you also have to then have time for your own self, your families, and all your other external commitments. You can't just go from one to the other. There's this thing in the plane whenever they give the whole safety videos and the oxygen mask drops down, you're supposed to first put the oxygen mask on yourself before you assist the person next to you.
Yeah.
And so that kind of thinking also applies to us. We can't pour from an empty cup, okay? So taking time and building into our weekly regime time for ourselves, whether that's journaling, whether that's a sport, whether that's just a walk, but we have to build in time for ourselves, for us to be able to decompress mentally and not ignore or jump from one to the other, because it's not a sustainable way of coping. I think the whole idea is we have to be able to cope with the stress, not run away from stress and not expect a stress-free life, because that doesn't exist. We have to be able to cope with everything.
There's no stress-free life.
Doesn't exist, I'm afraid.
That's a heartbreak to me.
Yeah.
I thought there's a chance there might be a stress-free life ahead. What's the space for therapy in this?
Yeah, I mean, therapy, it clearly works, but there's a high barrier to entry because of the whole stigma associated with it. I mean, when I used to work in London, I think people were more amenable to accessing therapy. It was something that was conversed more often, and more people were familiar with it, both men and women. But then having moved to Kenya, you suggest therapy to a man and you just get a blank stare at you. And I think the whole concept, or rather misconception, that I'd like to clarify is that therapy is not just talking about your feelings, okay? Men don't necessarily want to open up and just talk about their feelings. That's not what therapy is. What therapy is being able to, a therapist is able to identify certain thought patterns and how you frame certain problems in your life or certain stresses in your life, and give you the psychological skills to be able to readdress that and reframe things. Because ultimately, if you want to start reading about all these sort of philosophical books like on Stoicism and all the ancient Greek philosophers, Stress is all about how we have framed a certain threat. If you reframe the threat, it no longer becomes a threat. And so that's where therapy plays a crucial role. We're able to reframe what we
you
are.
think is
Correct.
a threat to you.
Exactly. Without then necessarily having to feel like we have to run away from it.
I think it's how therapy has been presented.
Yeah.
That could be a problem, because all I have known as well is, you walk in, pull a chair, and let's unpack your childhood.
Yeah.
That's everyone's thought. It's like the first thing the therapist is going to ask is, let's unpack your childhood and see where the trauma started from, or maybe that's how social media has presented it to us.
Yeah.
And it makes it really hard for a Kenyan man to walk in and start, speaking about his past.
I think that's the concept where you think, you have the stereotypical where you just lie down on the couch and you're just talking, like you say, about your childhood and whatever. Obviously, that will form a part of things, because our environment and the fact and the things we face as children naturally shape us as adults to a certain degree. But a good therapist will never imprint their preconceived notions onto the person. And it's, like I said, it's all about being able to guide and steer a conversation around topics where there clearly needs to be some work, and it's the whole question with therapy as well. It's, you can't just have one session and expect to be, fine. The same way you don't go once to the gym and walk out looking like Arnold Schwarzenegger. It's a work in progress. I have a very good friend actually in London. He's a child and adolescent psychiatrist, and part of his scope of work is in therapy. And he was saying that therapists also need therapists. And you would think, what?
Why does...
Yeah, but
I
it's
thought
actually,
they have all the answers.
Well, yeah, but it's mandated that a therapist there needs their own therapist, because no one is immune to these kinds of things. You can always learn from another perspective on how you are approaching
your own problem.
Correct.
Yeah, I like that. So therapy should be easy for men now if they thought of it as reframing threats.
It's not easy to begin with.
Okay.
No, it's not easy.
Okay.
But, to make an omelette, you have to break a few eggs. Okay? So the same way, the first time you go to the gym, it's not easy.
Yeah.
But as you go through the motions of it, it becomes more familiar. I think men are scared of what they don't know and what they don't understand. And so often they want to run away from that or not engage with it. But once it becomes familiar, then it's something that they can engage with a little bit more. I say men, I think human beings in general, we're always afraid of what we don't really understand. So, therapy, it gets, I wouldn't say a bad rep, but we have to reframe what exactly it is, because it's 50% of all mental health treatment pathways. Medication doesn't get you necessarily out of the slump. It just helps the therapy to embed.
Okay. So just makes your body receptive to the therapy.
Exactly.
Okay. One other thing I've had, just to throw it in there, is men saying that nobody has answers for my problems. So there's no need for me to go to therapy, because if I can't solve them, they can't solve them. But I think the issue there is thinking of it as a problem-solving session. Walk in with a sheet of problems and then walk out with answers written down below that. And I think how you've said the reframing.
Yeah, no one will give you the answers to your problems. I mean, the therapist isn't going to know how you're going to deal with KRA's emails, or if you're getting, your boss is emailing you about these deadlines. They're not going to know. Yeah. But they're going to be able to equip you with the skills of being able to see the problems for what they are and how you can then overcome them.
Right. Are there foods that will make my mental health better?
I know foods that will make your mental health worse.
Oh, okay.
Yeah.
Oh, we could start with those.
Yeah. So obviously, if you avoid the things that will make things worse, then you're halfway there, right? So the first one is alcohol. So alcohol, by its nature, is what we call a depressant. So it'll slow down your circuitry within your brain. It's going to play around with your hormones within your brain or your neurotransmitters. And it often just gives people an outlet to, so to speak, forget their problems. Meanwhile, it's also going to affect you metabolically. So it's going to increase your cholesterol, your risk of liver problems and heart disease and so on and so forth. There is no technical safe limit of alcohol. I mean, no alcohol is the safe limit. But that's not necessarily, relevant for people because it's a socially acceptable, outlet. As long as you're able to, like I say, do what you need to do, then, a little bit of alcohol, by and large, will be fine. But recognizing if you're using alcohol as an outlet, that's the first place to start, where you say, okay, fine, I don't want to necessarily embark on therapy, or I'm not ready necessarily to jump into the gym yet. Why don't you cut down from maybe half a bottle of wine to, or binging on beers on the weekend or having a nightcap? Why not cutting that by half and then by half again and see how your body responds? Because once that's not in your system, you often feel a lot better for yourself. So that's the first. And then the second one is these hyper-processed foods. So, fried foods, oily foods, very caffeinated foods as well. So, your Red Bulls, your pre-workouts, your excessive teas and coffees, that's going to make your stress much worse because that's going to push what we call your sympathetic nervous system into overdrive. So you're going to be firing off adrenaline, you're going to be firing off cortisol, all these other things. So it's just going to compound the problem even more. To then answer the flip side, well, what foods will make your mental health better? I mean, it's not really a specific food, but I think just a general, reasonable, balanced diet is the place to start with, yeah.
There's no carrots for the brain, like carrots for the eyes.
No, I'm afraid not, no.
Okay. When we talk about depression, it's just one of those other times, just like stress. It's like, I'm depressed this week. Oh, I'm depressed. How do you tell you're depressed? Is there a way to tell, or even tell on behalf of someone else and be like, I think you should seek some help.
Yeah.
This is depression.
Yeah, that's a really good question because we do need listeners to understand that difference.
Yeah.
To have a short period in life where you are depressed is somewhat normal. I mean, we're human beings. We're not robots, okay? Emotions give us color to life, okay? Happiness is one and sadness is the other. And so the words sadness and depression are not necessarily interchangeable. If you have the death of a loved one or a breakdown in a relationship, you're going to naturally go into some form of mild depression, as long as you're able to come out of it. Where it starts becoming a problem is if the symptoms are starting to persist and affect your day-to-day life. So you're not getting out of bed, you're not looking after your appearance, you're not, washing regularly, you're not dressing, then you're not eating or eating too much, you're sleeping or sleeping too much, you're showing up late to work or missing work. These kinds of things are red flags. So you're not able to do what you need to do in the day. Your mental health is now stopping you from doing so. As far as diagnostic criteria is concerned, the time frame is 2 weeks. So if you are sleeping 16 hours a day, for 2 weeks, so you're sleeping at 1 a.m. and then waking up at 5 a.m. because you just can't go back to sleep, or what we call early morning wakening, or you once used to enjoy paddle and now you don't feel like it, or you feel apathetic towards it. These are kind of red flags for now clinical depression. And so if these symptoms are persisting for 2 weeks or longer, it'd be a good idea to speak to a doctor, either a psychiatrist or a family medicine consultant, or a clinician, to be able to say, right, we can't let things escalate here. Because men and depression, it escalates very quickly.
It does.
We don't want to talk about the S word, but it's something we do have to talk about. And suicide is a growing, I wouldn't call it a crisis, but it's a growing issue.
And in Kenya, actually, that's one of those stats I had here, where the highest rate of suicides are men.
Yes.
It's been a whole thing. Even Ken BS has statistics here, percentages and all that. Is it that men are easily, what makes men easily fall into that depression pathway?
So when it comes to the studies of suicide and the human experience to get to that point, women are more likely to attempt it, but men are more likely to actually do it. And so when you are assessing a patient, this is when I was a junior doctor in the NHS in psychiatry, spent time in psychiatry. Just being a man reporting suicidal ideation, meaning they've contemplated not being here. We're not even talking about planning anything. That's just by you being a man and saying, yeah, I've had thoughts of not being here, or the world will, the world would be better without me here. That's already a high risk, because men are so much more, for whatever reason, likely to just, I won't say act impulsively, but follow that thought out. Whereas women have
an ideation.
Yeah, it's an ideation, but there's some backstops there. Whereas and typically men, the reason why they are more successful at going through with these dark thoughts is that they often choose modalities that are
extreme,
exactly. So we're talking of guns, jumping off buildings, standing in front of moving traffic, that kind of thing. Whereas women are more likely to take an overdose or to do something that's a little bit slower, so to speak. Whereas men are it's a binary moment. And so that's why it really emphasizes the fact that if anybody is concerned about a man in their life who may be struggling, we don't want things to escalate to that position, because there's definitely things that can be done to address that.
Okay. One thing that I've picked from my uncles, my father, myself, I think at this point, is a constant feeling of no safe space for my emotions. I'm in the office, toughen up, man up. Getting back home, it's demands, it's expectations. There's no safe space to speak. How do we create one for men where they feel like, people care about my emotions? I can get frustrated. I can get sad. I can want to cry. It's very hard for me to cry at KOFISI, because then now it's a whole story.
No.
Like, Richard these days, all he does is cry along the corridors. His work that bad. But, how do we ensure there's space for men to be vulnerable?
So men are often vulnerable when they're often surrounded by other men in a way. And not just randoms, but people that they have already established a connection with. And so what we find is that men are able to talk a little bit more openly when there is a goal-based activity. So you won't find men necessarily just, chatting over coffee about their feelings, but often you'll have like these run clubs where you'll just have men just running, and then conversation naturally goes and it flows into their own respective areas what they're struggling with in life, sport-based activities and that kind of thing. That doesn't mean that every man is sporty and, every man has to seek those kinds of environments. But I think it's a space which to be honest with you in Kenya is not, there isn't that much, but it is going to grow. But these men run clubs, for example, there's a couple in Mombasa that exist, and I'm sure that in Nairobi as well, it is something that's on the horizon. But just these kind of goal-based activities where it's not a workplace, it's not your home life, but it's what we call like a third space where you're able to have a communal feel, or like, communal social clubs where you can naturally have free-flowing conversation. I think for men, you're not going to get a dedicated therapy session with your mates. You have to have an open channel of dialogue where conversation can just be free-flowing, and you can actually say what you think about certain things. And eventually, you know, people are eventually going to talk about their feelings and their thoughts on certain things. And often, when you find that one person is being vulnerable and opening up to you, you can then also feel the same way. And you're not expecting to fix each other's problems, but at least that somebody has a lending ear. So I think if you want to talk about yourself, first reach out to someone who you're close with or relatively close with, and start doing sort of group-based activities, whether that's just going for a walk, whether that's going to, you know, do some shopping or whatever.
Start a podcast.
Have some kind of activity-based feature. Conversation will naturally flow. I think with men, they're too isolating. They often shut up shop, live in their own sort of silos, and try and deal with things in an echo chamber, and nothing good will happen out of that, because
just boiling.
Yes.
Yeah.
You're just sweeping it under the rug.
Yeah. If we were to track, I'm sure we've spent quite some time. So I'm being told we haven't spent so much time. They're enjoying the conversation. Free therapy. Free therapy.
I can see a box of tissues in the back.
I like it. If I was to track something every week, this question was supposed to be if you had to track something this week. But I think let me just use it generally across every week going forward. If there's something that I should just keep checking on myself, what will that be as a man?
Yeah, that's a loaded question because I actually have a few patients that I was working with, and in your stereotypical, man's mental health case comes in to see me for palpitations, reflux. Another one came in to see me because of fatigue, and of course you go through all the physical health complaints and you go through all the investigations and nothing comes back, and these guys on the other end are like, what's going on? They start questioning you as a clinician, and it's like, no. Let's look at the bigger picture. Eventually, of course, it's a mental health issue. And so we talk about, okay, how do we keep tabs on things? And most of those guys have smartwatches, and they're like, okay, I'm gonna check my my heart rate, my resting heart rate. That's going to tell me this. So it's a loaded gun if you want to have an individual metric to say, okay, this is how I'm going to keep my keep track of my stress. I'll give you a non-wearable and a wearable option. Okay, because wearables are as common as clothes nowadays. The non-wearable option is your sleep. Sleep is such a difficult to understand concept in medicine. Often people will come to you and say, okay, doctor, I'm having problems with my sleep. And sometimes it's a hard conversation to have, because I have to tell them, actually, it's not your sleep that's the issue. The sleep is the symptom of an underlying issue. What that underlying issue is what we have to figure out.
Don't sleep it off.
Yeah. So either you're sleeping too much or sleeping too little. If you find that you're sleeping a little later than usual, or you're waking more often in the middle of the night, or you're waking up earlier, these are signs that something is simmering under the lid. And so, of course, everyone has the one bad night, on occasion, or a couple of bad nights on occasion. But if you start noticing that, hang on, over week by week basis, your sleep schedule is starting to become erratic, you're doom scrolling a lot more before going to bed, that kind of thing, that's something that you can keep a tab on and say, right, I need to have hard limits. I need to stop screen time, an hour before going to sleep. I need to have some mental downtime. I need to be reading a book. I need to not be watching TV. I need to be either journaling, meditating, yoga, whatever, exercising, it doesn't matter. But you need to step away from the screens at least an hour before going to bed to try and help promote good, long-lasting sleep. So that's the first thing. Sleep is the non-wearable option. The second thing as far as a wearable sign is something called heart rate variability, or HRV for short. Now, everyone will have a different wearable, whether it's your Aura Ring, your Whoop strap, your Fitbit, your Apple Watch, whatever. All of them will give out some kind of a strain score or a recovery score or some so-called proprietary score. And that's what you're going to keep chasing. And all these scores are based off heart rate variability. Now, what heart rate variability is the time gap between each heartbeat. The idea is we want to have an increased amount of heart rate variability. We want the gap to be variable between heartbeats. The human heart is not supposed to be a metronome. It's not supposed to be
just beating,
ticking in a constant fashion. You're supposed to have, let's say, if you have a heartbeat of 60 beats per minute, you're assuming you're having 60 seconds between each heartbeat. You're supposed to have 65 seconds, 55 seconds, variability. If you've got low variability, meaning it's becoming more regular, it means that your heart is, your body is pushing the accelerator down. Our heart is under a constant balancing act between the accelerator and the brake pedal. And so that heart rate variability is where both pedals are being adjusted on the fly. But if the accelerator is just being pushed ever so slightly more, the variability will reduce. And that's not good. So that basically means your heart is being exposed to more adrenaline, more noradrenaline, more cortisol, more less testosterone, less thyroid hormones. So the heart rate variability is often a sign where you can actually have a number value to your stress. And often the heart rate variability will flag up before you can feel it. Now, individual heart rate variability numbers doesn't matter. Everyone, person to person, will be different. You have to look at the trend. So if you're starting to notice that the trend of your heart rate variability is going up, something is simmering. Now, of course, if you're falling sick, you're sleep deprived, you're jet lagged, you've been traveling a lot, that's also going to affect your heart rate variability, but that will also affect your stress as well. So that's the other metric that you can use to kind of give a better insight in yourself. But it's important not to obsess over that.
All right. I was going to ask, how should I be checking with my doctor?
No, that's Friday? The thing. So that's the analogy with those other patients that I kind of started off at the beginning, which I forgot to tie in, is that they were then obsessing over these metrics. And you have to say, hang on a second, what are you doing? You can't live your life connected to a blood pressure machine. You can't live your life connected to your Apple Watch and just constantly audit the data.
That's new stress.
That's going to compound your stress even more.
I see it. When we were speaking about extremes in men and, going through with dark thoughts, I just thought about another extreme case, which I think I should ask now, which is men, and you could correct me if I'm wrong, men tend to be extreme even in how they, manifest whatever is going on in their, so there's GBV, there's aggressive behavior. You see it even, as you mentioned, alcohol. In those kind of settings, it's easy for someone to be aggravated and, do the craziest of things. Is solving men's mental health the key to world peace? Will we now have peaceful communities and families and, if we tackled this?
It's. I think we're painting with a broad brush here. I think there's a phrase in feminism and sort of these feminist worlds is that men are the ones who start wars, no wars have been started by women. And so I think maybe that's the analogy. That's a topic for a different day. But you're absolutely right. Men's outlets sometimes is that they can lash out. And so the mental health burdens that certain men may face will spill over to other people in the family, children, spouses, parents, what have you, colleagues. And so, I think as a man, if you find that you're easily lashing out or you get angry very easily or you're now starting to have difficulty controlling your emotional outlet or you don't want it to spill over into violence, but it is a real threat. These are not even warning signs. These are signs that something urgently needs to be addressed because men, when they're pushed into a corner, will either fight or flight, have that system kick in, and more often they'll fight. And so they'll try and dull things down with, external things like, alcohol and other substances. But yes, it's a case where if you find that you're boiling inside of you, you do need to make sure that we're taking steps to address that.
Okay. Thank you very much, Dr. Moez.
No,
we could have this conversation on, and I'm sure we'll continue with it either on a podcast or at an event, a wellness event or a wellness session with KOFISI. So I hope that the KOFISI members who've tuned into this have picked something to help them cope, because we can't do away with the stress, as we've said. We can only cope and find ways to be better and do better. If they want to speak to you on matters family medicine, weight gain, weight loss, I want to speak to you about weight gain. I don't know if I have been stressed for so long that I am not getting that weight gain through, but that's a conversation again for another day. Where can they come through and find Dr. Moez?
Yeah, so I'm on social media, on Instagram with Dr._Moez Dungarwalla. So I put a lot of health advice out there, just easy to understand health information, both, mental health is one, but physical health is the other. I just really, my real passion is getting my patients to really understand their bodies so that they're not reliant on a doctor to, sort them out. They have to be able to make decisions on the fly, and really understand what a doctor is asking of them, or when they're suggesting to take medication. So that's a big thing for me. As I said, I'm mainly based in Mombasa, but Nairobi is pending. So that's going to be in the pipeline soon. So hopefully have a clinic within the next few weeks in Nairobi. Yeah.
Okay. All right. Thank you very much for coming through to KOFISI.
Thank you.
It's been a pleasure for me.
Thanks for having me.
Half healed.
I'm glad. Thank you.
Thank you for tuning in to the KOFISI Connect podcast. I'll catch you in the next one.